Hello and welcome to our public health webinar. My name is Syed Mehboob Shah. I'm professor at the Institute of Public Health, College of Medicine and Health Science, United Arab Emirates University. This webinar is part of the global campaign, This is Public Health. We are also very proud to be affiliated with ASFAR, Association of Schools of Public Health in European region. We are going to organize our webinar monthly with the aim of bringing interesting speakers in order to highlight different important public health issues. Our webinar is accredited by one SEMI from United Arab Emirates University. And today, this webinar, you will be able to ask questions, and you can do so by clicking on the answer question options in the middle bottom part of your screen. You can submit your question during the presentation, and we will try to cover all questions in the end after the end of the session, depending on the time available. At the end of the webinar, we will share the link in the chart for your evaluation of the webinar. You need to fill this evaluation link to obtain your certificate of attendance in this webinar. Now, allow me to introduce our speakers for today's session. We are really very honored that our invitation was accepted by Dr. Padmini Mothi, who is a globally recognized health professional, and in her role as a physician and public health expert, currently she serves as professor and global health director at New York Medical College School of Health Sciences. And she practices in USA. She is currently serving as chair of the International Health Section of American Public Health Association. She is a global health leader for the American Medical Women's Association. And for past 30 years, Murthy has been working globally in different projects and programs. So we are really very honored to have her here in this session so that she can share her expertise and work with us. And she also contributed a lot during the COVID epidemic. And Dr. Mothi has made over 150 presentations nationally and internationally. And Dr. Murthy has research interest focusing on women's health and human rights, social determinants of health, global health diplomacy, and promotion of global health. She has received numerous awards, both internationally and locally, and we are very fortunate to have her. So now I will request Dr. Padmini to take the virtual floor, please. Thank you.
Thank you so much. Thank you so much, Professor Shah. I appreciate the kind introduction. Greetings, everybody from New York, where it is now 11 a.m. So good evening, good night, good afternoon, wherever you are. It is always a privilege to meet colleagues from other parts of the world. I would especially like to thank Professor Shah and also Dr. Talal for extending this invitation, and Professor Gravina. Thank you so much. So I will start sharing my screen now, and we'll discuss. And if you have any questions or comments, I look forward to hearing from you. So can I share my screen now? Can everybody see my screen?
Yes, clearly.
Yes, yes.
Thank you very
yes.
much. So, and it is in that. So thank you again. So today I will be discussing briefly aid effectiveness and multi-stakeholder partnerships in public health. As we all know, the past 2 years have been very, very challenging because of COVID. But this has not reduced the need for aid and partnering, working together. And one of the very important lessons, which I think I have learned, and a lot of us are we need to make best use of the opportunity and technology. So that is why it is really an honor and a privilege for me to share briefly some of my insights into this. So as we all know, I really like this definition, which was published in the Lancet in 2009, where it says that global health is an area for study, research, and practice. I am not going to read from my slide because that is not the way you do a presentation, but I just wanted to say global health is multidisciplinary. And that is why in coming up with the partnerships, we have to work across disciplines, whether it is academia, think tanks, foundations, governments, United Nations agencies, country governments, and NGOs. It is very important. As you can see here, I have the United Nations 17 Sustainable Development Goals here. And I also have this Rubik Cube puzzle here, which you can see because that demonstrates how all the pieces, all the partners need to work together to have and promote aid effectiveness, which is purposeful. So there are the three P's which are very important in public health. That is partnerships. And then you need to, promote partnerships. And this has to be the way the whole background of public health goes. And what is the fourth P? Well, esteemed colleagues and students, it is perseverance or persistence. In order for us to be successful as public health professionals, to help out our colleagues or communities in need, we need to be persistent. And we need to not only focus in aid effectiveness on getting the aid, but also prevention and promoting sustainability. So that is why the headers on my every slide, I have the puzzle, the Rubik Cube, and I have the SDG goals, because we cannot achieve SDG goals without partnership. We cannot have effective aid projects or programs in place without partnership. So what are the key elements in global health? We all know that it's improving health. That means it's just not treating a person or communities of any disease they face, but it also, you need to look at promoting equity, addressing the social determinants of health. That is, where does somebody live? Do they live in a rural area? Do they live in an urban area? What is the geographic distance they have from getting any healthcare facility, accessing a healthcare facility, accessing healthcare services? This is very important. Why? You might think, why we are supposed to be hearing what she talks about aid effectiveness, partnerships? Why is she talking about social determinants? Because the type of aid you give depends on the social determinants and the community you are serving, whether they are rural or urban. So I hope everybody is clear as to why I am introducing the relationship between the key elements of global health and also between aid effectiveness. Now, it is so important for disciplines to work together. Public health, what is it? It is a compromises, it is cross-disciplinary, it cuts across all levels. So you must be aware that just public health does not refer to health professionals. There are lawyers, sociologists, entrepreneurs, technical people, government officials, non-government officials, NGOs, the United Nations agencies, foundations, private donors. All these people are crucial in partnering to have a good aid approach. And I will discuss this with you by giving specific examples of the work I have been involved with, either working with other colleagues or, spearheading it myself. So as you can see, this is a very interesting slide, because what are the effectiveness principles? Effectiveness is very important when we discuss aid. You can see country ownership. Why is country ownership important? For example, the country needs to say that they have their own priorities and they are going to do this within the guidelines in their country to provide aid to the people in the country. Please note, aid is just not us doing for people in other countries. It is also helping those who are in need in the countries, in our own countries, that is where we live or where we work in. And let me take this opportunity to introduce something which is very important for students of in public health or any health discipline to know. There is a difference between health equity and health equality. Equality is making sure you distribute the resources to everybody. Equity is when you are trying to make sure the people who have lagging behind are brought to the same level. So this is something I need you to understand. And then we need to focus on the results, because remember, we are not doing all this for personal greatness. We are doing this for a purpose. So in order for the purpose, we need to start focusing on the results. So in any aid program, whether you are raising funds to help somebody locally or involved in a bigger project, you always need to have the whole thing, the whole process of monitoring and evaluation tied up in your healthcare projects. Otherwise, it will not be successful. You can't say, oh, this failed. Maybe I should have thought about it. So why is it that some projects to give aid are more successful than the others? Ask yourselves the question. The answer is simple. Maybe they did not anticipate the challenges. Maybe they did not have the elements of monitoring and evaluation built in right at the start of the program. We have to focus on results. So what are the results you focus on? You focus on the individual results, you focus on the community results, you focus on the national results, you focus on the global results. This is the thing, inclusive. Oh, I'm sorry. This is, the computer has a mind of its own. Sorry about that. Yeah. So I just wanted to say, when we are looking at inclusive partnerships, you need to have a partnership, again, P, which is purposeful, which is practical. I add another P. I'm not saying it because my name starts with a P. You might be wondering, why is she only talking about P? But because in public health, purposeful partnering is very important. And practicality. You cannot have this. You might be having millions of dollars, but if you do not have a practical approach, your aid effectiveness will not be optimal. Your project will be suboptimal. I hope everybody understands. The last but not least on this is transparency and mutual accountability. Please remember, whenever you do any project, whenever you undertake any project, it is so important that you are transparent with your partners, with the stakeholders, that is the people who give you the money, and there is accountability. This accountability is every individual needs to have the accountability to make sure the project is successful, make sure that they do the right thing, and also even the stakeholders. For example, if a foundation says we are going to give $10 million to do this project, they need to have the accountability that they give $10 million. Now, whether they give it in the form of monetary funding or in the form of kind, this is very, very important. So this is what I would like to say, that the transparency and mutual accountability is very important, because only then will you have a successful aid project which can be replicated. Because you don't want to say, oh, this person took the money, but where are the results? So scrupulous budgets, having a timeline, having reports, all these are crucial and are in short, to conclude this slide, are effective in the principles affiliated to purposeful and optimal aid delivery. Okay, so I really like this cartoon. As you can see, what are some of the, why it's important to have partnerships for effective cooperation. And I really like this because you need to have a clear or coherent national framework. You need to increase the impact, and the planning needs to be streamlined. Like you can't say, oh, I'm going to do this, and suddenly backtrack and say, no, I'm going to put this. So it needs to be very clear. That's why it's important to have a timeline. And the other issue we all need to be very, very cognizant and important is you need to listen. You need to listen. You need to listen to the people you're bringing the aid to. You need to listen to your colleagues. If you're a project manager, you need to listen to your stakeholders, who is giving you money, and the clients you serve. You cannot say, oh, I am this great person. I am an expert in public health. I know everything what is needed. And also communication, another C. Clear, concise communication is crucial. So clear, concise communication is crucial for the success of a project. So that is why it is so important we do all this groundwork, and it is a constant process, because you might have the best plan. It is successful somewhere, but please note, you always need to have flexibility in changing how you deliver aid, because especially in an emergency situation, which is developing so rapidly, you also need to make sure you have the same flexibility to adapt to the changing situation. I hope this is clear. I move on to the next slide. So this is very important, and I would strongly suggest very respectfully to the students and colleagues that you can go online and look at the Paris Declaration on Aid Effectiveness, which first came in 2005. It is an excellent document, and also the Accra Agenda for Action. The reason is because this Paris Declaration for Aid Effectiveness came in Paris. That's why it's called the Paris Declaration. And the Agenda for Action came in Accra, Ghana, which is the capital of Ghana. So that is why you have this in 2008. These documents are available online. So I would suggest that this is a very good they are small documents, not a lot of papers. So I don't want the students to feel, oh, we had an international professor talking to us, and she talked about documents which are maybe they are very, very long. No, they are very concise, clear. And my recommendation is, whenever I have given talks anywhere, if I'm talking about aid or partnerships, I strongly recommend, if it's a student audience, to make sure you download these and read these, because they're really useful. Okay, so what is important? And as I said, I talked about ownership, but I would like to talk about alignment. Why is alignment important? That means there are donor countries. Now, why is it like, the US? In the US, we have what is called US aid. We give millions of dollars, as does UAE, as do other countries for aid. But what is the alignment? For us, one of the priorities under the current administration, and this reason I'm telling you not to talk about politics, is we are looking at HIV/AIDS. So we have this whole HIV/AIDS program as a part of the US aid, where funds are committed to other countries to address the challenge of HIV/AIDS. Now, COVID, a lot of countries, we had one of the best examples of aid is COVAX, where a lot of the countries got together, the member states, and gave billions of dollars for vaccines to Gavi and other partnerships. So that is the alignment. That means when somebody, agency, a foundation comes up with a project like this is what we want to do, you go to donors whose beliefs from the countries and the foundations are behind these objectives. Some of the largest foundations we have, when they give money for aid, they give money to the projects which they believe in and they are funding. So that is what you need to remember: alignment. And harmonization. It is very important to share best practices because, you know, everybody is competing for the resources. You do not want unnecessary replication of work so that of doing the same thing and or doing something which has not worked. So it is really crucial to share information. And also the results, as I said, is very important. And, you know, just what was on the slides, I just put here again, everybody has mutual accountability because this is so important. I had it in that cartoon and also in bullets on the slide because this is crucial for the success of any aid project. Now, as you can see again, the ACRA agenda is a little different where they're talking about capacity development. Why is capacity development important? You need to understand, you give money to somebody. Excuse me, you help somebody, but you also need to help them so that they can learn the skills to help themselves. So that is capacity development and is closely linked to the agendas of the Sustainable Development Goal 17, which focuses on global partnerships. So capacity development is very important. So now you understand why the Paris Declaration and the ACRA agenda go hand in hand for people when you are looking on how to effectively deliver aid. The other thing you need to understand is when you are delivering aid internationally, you also need to look at the rules of that country, because every country has a set of rules. There is a protocol. So before you start on this project to save the world or save somebody, you need to work with the local countries. And that is what I'm going to talk more about in giving you examples. So this, I just wanted to give you, this is from a few years ago. You can see me with my students, medical students, other colleagues, and this is the wife of the American, she's American, but her husband was the ambassador of Malawi to the United Nations. And we all worked together to come up with safe motherhood kits, because Ghana, Malawi is one of the countries, which has a very high maternal mortality rate. So we partnered, that is New York Medical College, partnered with the mission, the permanent mission of Malawi to the United Nations, the local community, and with the First Lady's office in Malawi, where we put together these safe motherhood kits, because these the rates of maternal mortality are high and they have a very low GDP, and the number of trained obstetricians in Malawi is very, very low, and it is a hilly region. So we worked to provide aid in the form, and this was not emergency aid, please note, to give them, to help them by providing 500 safe motherhood kits, giving funds to build a maternity waiting home, because Malawi is very hilly, transport is difficult. The pregnant women had to walk sometimes 2 hours each way to reach a local clinic to get, the checkup and walk back. So that is why, and women in labor, they cannot keep walking almost 3 to 4 hours. Too poor, either transport is not available or they cannot afford to have transport. So what was done is a waiting room was built in the middle so that women can stay in that waiting room before they go to the hospital to have their delivery. It also encouraged more women to have seek assistance, like safe have skilled birth attendants when they had their children, and it also reduced the overcrowding of the primary healthcare center or the hospital, because they could only take patients when in labor or at high risk, and the others could be in the waiting room. And if they had any emergency, they're getting medical attention, the time is a lot reduced than if they had to come from their homes, which were of much further away. And then this is another partnership. This is at the United Nations, the WHO, World Health Organization, and the World Health Assembly is starting soon, next week, has an office at the United Nations called WUN. So I took a lot of our students, and this is for the Alma Ata Declaration. As you all know, Alma Ata Declaration is one of the first declarations which came out, which is the precursor to the MDGs and the SDGs, which wanted to have health for all, so that was one of the main goals of Alma Ata. So again, this is something, this comes for partnerships. Why is this partnerships too? Because this has students coming, learning, and it promotes a way of how academic universities can work together and also with the United Nations to provide services when necessary. Now, sharing of best practices. This is another thing. This Global Health Forum has not been held in person. This is just before COVID in Taiwan, where ROC, where they have so many health experts come from all over the world to talk about what can be done. And a lot of times, providing public health services, creating partnerships is also on the agenda. And this is something I want to talk about. Thank you, Professor Shah, for talking about with the work I did during COVID. So there is an institution, an NGO called Sisters of Charity in Calcutta, in India, which was started by Mother Teresa. As you all know, Mother Teresa was an Albanian nun who came to India to care for some of the poorest people, and for which she was recognized and got the Nobel Prize. So they reached out to one of my colleagues whom I have worked with, Suchi Buddhist Foundation in the US. And she called me and she goes like, Minnie, we have this call. So what do we do? I go like, okay. Then I was talking to my daughter because, she has been a youth rep at one of the United Nations Department of Global Communication. And she had a friend based in Canada. And this young man, they're all work together. They're all friends and colleagues. So this young man, who's originally from India, but lives in Canada, he had contacts in India. So there was this lockout in 2020, but we were able to transfer funds to another Catholic organization there, and then locally working with the people. You can see masks and rice and wheat and potatoes and oil and onions was given for 3 months to the families. So this was an emergency aid. How did we do it? By partnering. Why was it successful? We had our objectives. There was transparency because when the sisters reached out, they said that this was the budget. They needed immediately so many masks. So 10,000 masks were sent. They needed, I think, 2 tons of rice, 2 tons of lentils. So they gave us the list. They gave us an itemized list of what they wanted. And then the budget was itemized. And then it was a partnership between faith-based NGOs, between youth, between my NGO, American Medical Women's Association, and also with the local businesses who sent it. So it was a multi-country partnership, United States, Canada, India. So this was really successful. So I just want to tell you that just by paying attention, being methodological, it is so easy to have a project which meets most of the outcomes we want. You can see this is one of the nuns. She is checking off in the inventory. You can see these huge big bags of rice and wheat which were delivered. Now, the other thing what we did is PPE, personal protective equipment distribution. As you know, we are still going through COVID. There was a major mask shortage. So even in the US. So what did we do? Working with some of the friends we got from overseas who sent us these face shields and masks, which were distributed by me here to the local fire departments, to the local homeless shelters, to so many people. Apart from that, so this was the first thing we did. So how was this done? This was done by a group of people who, who said, we can help you. So this was sent through UPS, and we did not pay customs because it was a donation, because we never sold these to get money. This was donated. So this is what happened. It was so effective. And even recently, some of the masks were remaining, and I dropped them off at one of our Rotary sites because I'm a Rotary member, and they went to Ukraine. So one of the things I want to tell you, we have organizations like Rotary, Lions all over, Kiwanis. They are excellent at providing aid because through local efforts, we are promoting global outreach, and even a $5 donation, or a 10 dirham donation, or a £5 donation, euro donation, whichever currency, whatever you can give, it helps because it is collective. So it is like when 10 fingers join, it is more powerful than one finger. So that's why even aid effectiveness is multiplied 1,000 times when people join together. The other thing I wanted to tell you, this is a small plane which we, we work with these private pilots on a program called Operation Pegasus in the United States in 2020, August, September. Because we have what are called the Navajo Nation, that means our Native American population who live in states like Arizona and other states. The term used is Navajo Nation. They were facing a lot of challenges because there was a shortage of PPE. So what did we do? Well, again, Deborah from Suchi reached out to me, and I reached out to her through AMVA. Working with the Attorney General's office, my colleague, Dr. Chen, working with the Attorney General's office in the state of Arizona, and with the medical and public health students in the state of Arizona in Phoenix. What we did is we worked with one of the local companies there, and you can see the pilots donated their time, and we dropped 80,000 masks, PPE, airdropped, because they're in a very hilly area, mountainous area, and also, very thick jungle. PPE was dropped when we could not physically give it to them, and also face masks. And these face masks were created by some of our young volunteers who printed out 3D face masks. So that is something we did. Then next year, what did we do? You can see this FedEx plane. There was a major problem with in India last summer because of the COVID, and they did not have oxygen concentrators. So one of my colleagues reached out to me. So we all got together. We had a fundraising. And do you know that more than $4 million were collected by all of us partnering, working together, the private sector, NGOs, everybody, people who wanted to make donations. And one of the major institutions, in India, Tata, they had a partnership with FedEx. You can see the FedEx plane, and we shipped all the oxygen concentrators. You can see that plane is from New York, JFK, FedEx plane. And we shipped all these concentrators going in. And you can see when they were delivered in India, we had an inventory. There was a very clear-cut a plan as to where it would go, it was signed for, and where it was used. So this was an amazing project, which I am so proud to have been a part of, which everybody got together. I mean, I don't even know some of the partners, but we all got together. We communicated via WhatsApp, via emails, via Google Meet, everything, you name it, Zoom, to get the aid across. And you can see this is like really, really crucial, and it was successful. And I think within like less than maybe 4 or 5 months, over $1 million. So much was, I think, yeah, more than quite a few millions were raised. I think 4 million to set up even oxygen plants. So this is something I wanted to tell you about how effective partnerships are. Again, you have people on a team with different skill sets. Some of them were excellent at raising money. Some of them were excellent at, creating the networks, about saying, okay, overseeing from plan A to plan B, logistics, supply, customs clearance. So this was a great example of private partnership, public partnerships across countries. So this was really good. And now moving on, 2022, what did we do? This is at the expo in Dubai. It was so amazing because one of the things, as you can see, because I just talk about this, menstrual hygiene day is around the corner. It is the month of May, but specifically the day is next week, on the 28th. One of the things I just wanted to say that we all got together, again, NGOs, the private sector from India, a private company from Netherlands, to talk about the importance of sustainable menstrual coalition. And we were so honored that we were given a chance to have this very successful webinar in the Women's Pavilion at the Expo. And what came out of it is now we have this coalition in which India, America, Netherlands at the moment is involved to get this project going in India to help women and girls to promote menstrual equity. And based on that, then it will go to the other countries. What I just want to say here, don't think that there are no challenges. There are challenges because people have, you can get into arguments, you can have something not going on time, funding can get delayed, but with planning, you always need to have a plan A and a plan B, and with transparency and, frequent updates, this does address a lot of the challenges we are maybe facing. And then the other thing I just wanted to tell you is partnerships. This was really, I'm very proud about, because with my friend and partner here, Dr. Eliza Chen, and also Dr. Sarah Lynn Mark, we launched this whole webinar series of One World, One War Against COVID-19, where we had, this just shows our colleagues from Germany, the UK and Taiwan. But why is this important? Because we shared examples of best practices, because aid, and also we talked about what are the public health measures, what are the medical interventions we put into place when addressing the COVID challenge. We had like almost 7 to 8, I think more than that, over from the start of the pandemic. And we still are going to have them again in summer. I think we're going to have one more. The reason I bring this up is this was physicians partnering together to promote public health. And this resulted in also us working together to send, Italy reached out to us. Oh, we don't have these, pulse oximeters. I'm just holding one up so that you know what it is. We don't have masks. So we were able to send it to them. And how could we do it? Because the way you do it, you fill out the proper paperwork, so that it is not stuck in customs. And, the recipient gives an undertaking that this is for aid work. It is not for commercial purposes. So all these are important. So this was really great. And some of the best practices we were all able to share in our own communities to make sure that we maximize the resources used. And the other thing I just wanted to tell you is, like, based on research and scholarship, is I have worked on, these two books. The reason I bring this up here is because when we were talking about technology in my other book, which I brought out during COVID with my colleague there, is as editor, I invited her to work on the book with me. We also talked about using technology in promoting partnerships for aid effectiveness. And I will tell you how. We are talking, so maybe some idea I give, like I'm going to say, how can students be involved? I have told my students repeatedly, you give up 1 cup of your coffee or cool drink, put that money, only one, not every day, it's just one time. $5 or anything else you can give. So that is how we collected money to send supplies to the Safe Motherhood Project I showed you. So local activism had an enormous global outreach. And the other project is we sent during the, what do you call that? During Ebola crisis, working with one of my students who was from Liberia. We partnered with Japaico, and we sent supplies, like we sent, what do you call it? We sent masks, gloves, sheets, caps, gowns, so many things, because we were able to transport them free of cost because of that. Then again, I had my students partner with AFIA, which is an aid organization. During the Nepal earthquake, we sent them a lot of supplies working with AFIA, because the container was free, because somebody donated to AFIA to send the container. Because remember, when you ship these, they have to be shipped in containers very specifically. And this was sent by us so that we work together. So what our effort was is to send them wheelchairs, walking aids, shoes, warm clothing, because Nepal earthquake happened when it was winter. So these kind of supplies. And remember, this was sent, and it was successfully because we worked with a local NGO. One of the other things I want to tell you as I'm finishing up my talk is, when you send perishable items like food or food items, you have to be very careful on how you do it, because that is a different way of shipping as is for things which are not perishable. Then I have worked with the mission, the former ambassador of Grenada to the United Nations. They had this horrible chikungunya, that is an infection caused by mosquito bites. It is a terrible infection where you have severe pains, fever. The treatment is these, like Tylenol, Brufen, Advil, NSAIDs, non-steroidal anti-inflammatory drugs. So I launched a drive with my students and colleagues, and within 2 weeks, collected 600 bottles of this, all these different pain medications for them, and gave it to the mission, who shipped it out through their diplomatic pouch. So this was, again, another good partnership. We could help them, we did something. So remember, partnership is just not giving money. There are so many ways of partnership, by building connection, building bridges, writing letters to corporate sponsors to get money, being there, collecting items. So there's all these are successful. And the reason I bring up this United Nations academic impact, because this was an initiative launched a couple of years ago, 2010, by the United Nations Department of Global Communication. It was called Department of Public Information then. And this was a very successful impact launched by the chief of the United Nations Academic Impact, the first chief, the founding chief. And all the universities around have become members. So many universities around the world. So even your university, if you are interested, I would suggest go onto the UN Academic Impact on the website, just type in UN Academic Impact and see how universities can apply to be members. Why is this important? It is so nice. For example, it is a matter of personal pride for me that we got chosen as the hub for the SDG 3 from 2021 to 2024. So each university is chosen from all over the world, and they are chosen to be hubs either for one term of 3 years or 2 terms of 6 years. So there are all these universities, and there are frequent information sent out to the students. Students can get so much of information. So this is like an amazing partnership. The reason I bring this up is because even from this partnership, the other day I was on a meeting where some of the universities talked about the aid they gave to Ukraine. So partnerships got together. It was very nice because we knew what worked, what didn't work. So you learned lessons to take it back to your university. So that's why, even though you don't say, oh, this is just formally launched to provide aid, when this partnering does come up with showing aid, showing the way to have aid. And that's all. This is my last slide. And thank you so much for the opportunity. I'm going to stop my screen share. Thank you.
Thank you very much, Dr. Murthy. It was just wonderful presentation. I have a few questions from attendance. So one of question is by Aisha Nomi. She's saying that when you are going to help, some of these countries, there are country rules and regulation which delays the process and it takes you waste time. So how you address those kinds of issues where countries are not facilitating, getting your help due to their own rules and regulation?
Thank you so much, Dr. Shah. Thank you for that question. Well, then you work with the aid agencies who have special permission from the countries. For example, Red Cross, Rotary, Lions Club. There are so many organizations who do have the permission, World Vision. That is whom you find the local chapter and work with them, because it's easier than you're going to the country government, because these mechanisms have already been in place. That being said, it's not always that easy, but let me tell you, at the beginning of my talk, if you remember, excuse me, I said persistence. You need to go at it. And when you are clear, please note that your communication, it can go through. So the best way is, that's why we have partnering to talk to countries, because some countries don't get along with each other. There are so many issues. But what you need to do is to find the local partner there and the agency with whom you can work. I hope I have answered your question.
Thank you. There is another question by Ishtiaq, and he's asking, and there are some conflict issues. Can you give some examples of how to help in conflict areas, helping people where there's already a conflict going on?
Thank you again. As I said, International Red Cross, and I mentioned the Suchi agency, which is a faith-based organization like World Vision, like they have, like, for example, one of my colleagues and friends, Deborah, as we speak, she again went to Ukraine, leading 5 people. So what they do is they go to the closest, like they went to Poland, and because they can't go directly into Ukraine till, to see how can they go to give aid. So the refugees who came from Poland, they gave them aid. So this is how there is still aid being given in conflict countries. We are trying to see what can we do in Sri Lanka. As you know, Sri Lanka is facing an enormous crisis. So this is how, by working with that, and there is also another very big NGO, which was founded in the US, but it is all over the world, called International Rescue Committee, IRC. They work in conflict areas. So there are some specific agencies who do work in conflict areas with whom you can work closely by. That's what I'm saying. You need to talk to because everything is available online. Suppose you want to help Ukraine. How can you students help Ukraine or Sri Lanka? So you have to go online to see or talk to people. So what can we do? We want to do something. So these are the ways, by communicating, on social media, there are so many groups. I know my daughter keeps telling me every day, oh, this group is there, that group is there. This is what some of my friends are doing. This is what we are thinking of doing. So this is a way. And also even talking to somebody, you can, even if they have technology like online, teaching them, talking to young students. Especially May is Mental Health Awareness Month. Even showing empathy, sympathy, it is so helpful. That is also a way of providing aid. And that's how you help in conflict zones.
So another question.
Answered your question.
Okay, another question is, there are you take medicine and then there are delays, and these medicines are expired. So how you address those issues in some countries?
Yeah, well, that is a legal issue. That is really hard. I am not a legal expert. So at the outset, let me say that there is what is called the TRIPS Accord or the Doha Accord, where the UN has come up with the rules for the pharmaceutical countries. Again, this is a major problem with regard to expired, because a lot of times the medicines are not expired when they are shipped, but due to delays, they are expired. But again, that is why we need to talk to the people in the pharma industry who do say that even though there is an expiration date, maybe it can be used for a certain amount of time if it is stored well. But again, I am not an expert to talk about that, because that is not my area. But I know that some of the colleagues and NGOs working with this particular issue you talked about, Dr. Shah, is being, what do you call it, addressed. That is why you need to have partnerships.
Okay, another related question, maybe you answer part of it. Amal is asking, how you address the political challenges in this kind of work.
Okay, so one of the things is political challenges are, that is why you work with these established international organizations like Rotary, like International Rescue Committee, like Red Cross, like UNICEF in the UN, because their mandate is apolitical. And there is also the Geneva Convention, which has to be honored, because if there is a Geneva Convention, every country has to honor that by prohibiting aid and not attacking religious or health facilities. So where you work with the NGOs, for example, Red Cross is apolitical, so these are well-established NGOs. That is how you work with them. So why do people make donations to these NGOs? Even though some of the money, suppose you give $10, $3 may go for the overheads like paying for staffing, paying for maintenance to the people, but you need to know that the remaining money goes to them. And you don't have to worry that there is corruption or somebody taking it. So that is another thing. You have to be very careful whom you give the money to. For example, when we sent this to India, we sent it because we worked with them and we got the permission. And we knew it went directly to the recipient. It did not go to a middle person. So when you are doing about this, it's very important that you have that channel of communication. And when I talked about transparency, but usually, even though there are political adversaries, there are countries which work for the sake of aid. So that is something, and again, that's why you have to talk to an experienced person and wonder where you are sending the aid to.
Okay, thank you very much. One of the issue is the sustainability of these programs, that some aids comes and then you initiate program, then it dies down. So what is the best way? It is dealing with the government health system for sustainability or NGOs? What is your experience?
No, actually, it is the NGOs, because governments come and governments go. Especially, it depends on the type of government we are dealing about. That is why you want to train the people. I can give you an example. A few years ago, I was involved with an NGO where we worked with a very poor community in rural South Africa. So what did we do? We had a limited funding, so we trained the trainers there. So we train the local community people to address maternal and infant malnutrition. How did we do it? We told them you use the local food, like you use what is available locally to make sure the pregnant mothers or their children get the proper nutrition, not say go by baby formula or go by multivitamins. So again, that is why it is the education, it is the communication which are crucial in public health. So this is how you try to see their sustainability, because nobody has the money or the resources or the time or the energy to keep on. That's why I mentioned very clearly that different kinds of aids. One aid is urgent aid. Like for India, we gave those concentrators. We are not sending concentrators again. They need to make sure that they have their stockpile up. We dropped the mask to the Navajo Nation. They needed it. We sent the food to the missionary sisters for the poor people in Calcutta for the 3 months. We help them during their crisis, then they make their own arrangements. So that is why the aid, it depends on what type of aid and the duration, and there needs to be an agreement between all the stakeholders, that is the donors, the people who are working on the project, and the clients who get it. This is very important.
Okay, thank you very much. I don't see any other questions, so I will, if anybody has a burning question, you can ask. Otherwise, we will end the session. Okay. So if you no more questions, so I will take these few minutes to thank again our guest speaker, Dr. Murthy. It was wonderful learning for all of us, because this is an important area where we are lacking, most of us, the experience how to deal with this kinds of situation. So at the end of this session, I would like to thank our colleagues and all the participants who attended this session. And I would like to thank those who made this webinar possible, particularly our management and UAE University, who gave us green light and supported to organize this webinar. The organizational and technical team, Professor Michael Gravina, our department chair, Al Sajir, who managed the technical things related to computer and online session. He was very helpful in this session, and particularly our colleague Ismail, who helped us all the time. And I would like to also thank Dr. Ifat, Ms. Bayan, and all our colleagues for helping, and Azhar particularly. Azhar, you are helping every moment, us to organize this webinar. Thank you very much. And so we will have our next webinar where one of our colleague who has expertise in digital epidemiology. So he will be, Emmanuel will be conducting the next webinar on June 28th. So you are most welcome to attend this session on digital epidemiology. and this will be happening on June 28th. And thank you all our colleagues in Institute of Public Health and College of Medicine for your cooperation and help. So keep well and stay safe, and goodbye. Thank you.
Thank you again.